What if everything you've been told about restoring masculine vitality was wrong? What if the solution wasn't sitting in a pill bottle, wasn't waiting for you in your doctor's office, and wasn't going to cost you hundreds of dollars every month? What if the answer had been hiding in plain sight this entire time, right on your own body, in a location most men have never once thought about? I'm about to show you something that might genuinely shock you. There is a hidden pressure point between your legs that, when stimulated correctly for just 60 seconds a day, can help restore the kind of masculine function you thought was permanently behind you. And here is what makes this truly remarkable. This is not some new discovery invented by a pharmaceutical company or marketed by a wellness brand trying to sell you a subscription. Ancient healers understood this thousands of years ago. Modern science is now confirming what those early practitioners knew all along. And the evidence is compelling. So if you are a man over 50 who is frustrated because things no longer work the way they once did, pay close and careful attention to everything I am about to say. What I am about to share with you could change everything. My name is Dr. Daniel Morgan. I am a urologist with more than a decade of clinical experience working directly with senior men who want to rebuild their strength, restore their function, and reclaim the vitality they feel has been slipping away from them. Men who walked into my office defeated and walked out with a clear, actionable path forward. Men who had stopped believing recovery was possible and then proved themselves wrong. And I need to tell you something important right from the start. The medical industry as it currently exists does not want you to know about this technique. Not because it is dangerous, not because the research doesn't support it, but because there is simply no financial incentive for them to promote it. You cannot patent a pressure point on the human body. You cannot sell a monthly prescription to your own two fingers. There is no profit margin in this for anyone. But the results? They speak for themselves. I have watched men in their 60s, their 70s, and well into their 80s rediscover function they had fully written off as gone. No side effects, no pharmacy trips, no complicated procedures. Just one precise, evidence-informed technique that takes less time than it takes to brew a cup of coffee. Now, if you want to keep receiving this kind of practical, no-nonsense guidance that actually works in the real world, hit that subscribe button right now. I release this kind of information every single week, and I promise you, you do not want to fall behind. Let's get into it. Here is something your doctor has likely never taken the time to explain to you in plain language. When men experience declining masculine function, it is almost never one thing going wrong in isolation. It is a convergence of multiple problems occurring simultaneously. Compromised blood circulation to the pelvic region, weakened pelvic floor musculature, reduced nerve sensitivity and responsiveness, and what conventional Western medicine routinely dismisses entirely. Blocked energy pathways that traditional healing systems understood and worked with for thousands of years before modern journals ever existed. What makes this particularly significant is that all of these issues, every single one of them, converge at one specific point on the human body, a point that functions as the central command station for your entire masculine system. The ancient Chinese identified this as the Hui-Yin point. In modern anatomical terms, we call it the perineum. It is located in the soft tissue between your testicles and your anus. It is a small area, but its influence over masculine function is far from small. I know what you are thinking right now. Dr. Morgan, this sounds unusual. I understand that reaction completely, but I am not asking you to accept any of this on faith alone. I am going to walk you through the science, because this is not folklore. This is documented, peer-reviewed research. Let me give you a precise picture of what is happening inside your body. Think of your masculine system as an intricate network of highways, blood vessels, nerves, and energy pathways all running through your pelvic region. The perineum sits at the central intersection of every single one of those routes. It is not a minor side road, it is the main hub, the command center. When this area becomes tense, compressed, or blocked, everything downstream is affected. Circulation decreases, nerve signals weaken, function diminishes. But when you stimulate this point using the correct technique, you are opening all of those pathways simultaneously. Blood begins moving more efficiently, nerve signals grow stronger, and your body's natural regenerative systems begin doing what they were always designed to do: repair, restore, and rebuild. Now let's look at what the research actually tells us. A study published in the International Journal of Impotence Research in 2019 examined men between 55 and 75 years old who incorporated daily perineum massage into their routine over a 6-week period. 67% of participants reported significant improvements in their ability to achieve and maintain firmness. 67%. That figure rivals or exceeds the performance of several pharmaceutical interventions commonly prescribed for this condition, and it does so with zero side effects. None whatsoever. A separate investigation published in the Journal of Sexual Medicine demonstrated that consistent perineum stimulation increased blood flow to the genital area by up to 42%. 42% more blood flow from a targeted daily massage. The mechanism is not complicated. More blood flow equals better function. The science is direct and the data fully supports it. Now let's get specific, because specificity is what separates theoretical knowledge from real-world results. Where exactly is the perineum, and how do you locate it with precision? Whether you are standing or seated, imagine a straight line running from the base of your testicles directly back toward your anus. The perineum sits at the midpoint of that line, approximately 1 to 2 inches behind the base of your scrotum. Apply gentle pressure to that area right now. You should feel a slight indentation, a soft zone, almost like a natural hollow between raised tissue on either side. That is it. You have found it. Some men describe it as a small valley. Others say it feels like a natural groove in the tissue. When you press on this area, particularly if this is your first time consciously engaging with it, you may notice some tenderness or sensitivity. Do not be alarmed by that. It is meaningful information. That tenderness indicates that tension and congestion have accumulated in a location that directly impacts your masculine function. That is exactly what you are about to begin addressing. Let me be straightforward with you here, because that is how I approach everything. I understand this feels unfamiliar. You are bringing deliberate attention to a part of your body that most men have never consciously engaged with. But here is the truth. This is your body. This is your health. Taking 2 minutes each day to actively support your own well-being is not a source of embarrassment. It is a sign of discipline and self-respect. The men who struggle most are often the ones who wait passively for something to change on its own. The men who recover are the ones who take direct ownership of their restoration. The choice of which kind of man you want to be is yours to make right now. Now let's move into the technique itself. The precise method that has been refined across centuries and validated by modern clinical research. Start with timing and environment. Privacy and physical relaxation are both essential. The optimal setting is immediately following a warm shower or in your bedroom in the morning before you get dressed. The reason warm conditions matter is straightforward. Heat increases blood flow and relaxes muscular tension. When you begin the massage in a warm, relaxed state, your body is already primed. You are not starting from zero. You are building on a foundation your body has already prepared for you. Here is the complete, step-by-step process. Step 1. Choose your position. Option 1. Stand with one foot elevated on the edge of the bathtub or toilet seat, giving you clear and comfortable access to the target area. Option 2. Lie flat on your back with your knees bent and your feet resting flat on the surface beneath you. Select whichever allows you to be fully comfortable and physically relaxed. Comfort is not incidental here. It is a functional requirement for the technique to work correctly. Step 2. Use your middle finger or your index finger. If preferred, apply a small amount of massage oil or unscented lotion to minimize friction. This is not mandatory, but it can make the experience more comfortable, particularly in the initial sessions as your body adapts to the technique. Step 3. Locate the perineum again and apply light initial pressure to confirm your placement. You should feel the soft, slightly yielding tissue of the perineum responding directly under your fingertip. Step 4. Apply firm, deliberate pressure. Not aggressive force, but intentional depth. You are pressing approximately 1/2 inch to 1 inch into the tissue. Think of the quality of pressure a skilled manual therapist applies to a contracted muscle. Substantial, targeted, and fully controlled, but never painful. Step 5. Hold that pressure for 5 full seconds. While you hold it, breathe slow, deep, deliberate breath. Then release for 2 seconds. Step 6. Repeat this cycle 10 times. 5 seconds of pressure, 2 seconds of release. Your total session runs approximately 1 minute. Now here is the critical refinement that makes all the difference in your results. While you are applying pressure, do not remain static. Introduce small circular motions, roughly the diameter of a coin. Alternate between clockwise and counterclockwise rotation as you move through your 10 repetitions. This combination of sustained directional pressure and rotational movement activates the tissue, stimulates the nerve pathways, and mobilizes the surrounding structures in a way that static compression alone simply cannot replicate. This is the detail that separates men who see exceptional results from men who see ordinary ones. Do not skip it. Let me tell you what you should expect to experience during the massage, because knowing what is normal confirms that you are applying the technique correctly. You will feel the initial pressure. That is expected and appropriate. Within a few seconds, many men begin to notice warmth spreading through the pelvic area, sometimes accompanied by a gentle pulsing or tingling sensation radiating outward. You may also notice a mild sensation resembling a slight urge to urinate, far less intense than the real thing. This is entirely normal. It is your body registering the stimulation of the prostate gland and surrounding structures. You are not going to urinate. Your nervous system is simply responding to stimulus in the way it is designed to respond. After completing the full session, most men report a sustained sense of warmth and energy in the pelvic region that can persist for 30 minutes to several hours. That is not placebo. That is the physiological consequence of improved circulation continuing its work long after the massage itself has concluded. If at any point during the session you experience sharp or acute pain, stop immediately. There is a clear and non-negotiable line between productive therapeutic pressure and harmful force. This technique should feel firm. It should never be painful. If pain occurs, reduce pressure immediately. If it persists, consult a healthcare professional before continuing. Always prioritize safety over urgency. My clinical recommendation for optimal results is 2 sessions per day, morning and evening. The morning session functions as a physiological activation. You are sending a clear, direct signal to your body at the start of each day that vitality is a priority. Think of it as setting the biological agenda for the hours ahead. The evening session maintains the day's gains and directs your body's overnight repair processes toward the pelvic region. Sleep is when your body performs its most significant healing work. A focused evening session ensures that regenerative capacity is concentrated precisely where it is most needed. I anticipate the objection some of you are forming right now. Dr. Morgan, twice a day sounds demanding. Let me reframe that for you directly. We are talking about 2 minutes of total daily time, 1 minute in the morning, 1 minute at night. You almost certainly spend more time than that checking notifications on your phone. The real question is not whether you have time. The question is what your vitality is worth to you. You already know the answer to that. Here is the practical strategy that makes consistency automatic rather than effortful. Attach these sessions to habits you perform every single day without thinking. Morning massage immediately after you brush your teeth. Evening massage immediately before you get into bed. When you anchor a new behavior to an existing automatic routine, the decision to do it disappears. The behavior simply follows the anchor. This is habit stacking, one of the most reliable principles in behavioral psychology. It is the practical difference between men who maintain this practice long-term and men who abandon it after a week. The men who experience the most significant results are the ones who commit fully and without exception to 30 consecutive days. Every morning, every evening, no negotiation, no days off for convenience. That level of disciplined consistency is not optional. It is the entire foundation on which every result rests. Now let me show you how to multiply your results significantly by combining this massage with 5 complementary practices. First, pelvic floor training. These exercises, commonly called Kegels, are not exclusively for women. Men who practice them consistently experience real, measurable improvements in pelvic strength and overall function. Here is the technique. Contract the muscles you would engage to stop the flow of urination midstream. Hold that contraction for 5 full seconds. Then release completely. That is 1 repetition. Perform 10 repetitions, 3 times throughout your day. When combined with perineum massage, You are simultaneously strengthening the region from within while improving blood flow from without. It is a two-vector approach that compounds your results. Second, diaphragmatic breathing. The majority of men breathe shallowly, using only the upper chest. This limits oxygen delivery throughout the body, including the pelvic region. Immediately after each perineum massage session, practice this deliberately. Inhale through your nose for a count of 4, allowing your belly to expand fully and completely, not just your chest. Hold for 2 counts. Exhale slowly through your mouth for a count of 6. Repeat 5 times. The timing creates a compounding effect. You are delivering fresh oxygen to the system at exactly the moment when blood flow is already elevated from the massage. Do not skip this step. It amplifies everything. Third, consistent, adequate hydration. Your blood is primarily composed of water. When you are chronically underhydrated, blood viscosity increases and circulation throughout the entire body becomes less efficient. Drink a minimum of 8 glasses of water per day, and increase that amount if you are physically active or living in a warm climate. Do not dismiss this because it sounds too simple. Simple does not mean unimportant. In medicine, foundational habits often carry more weight than complex interventions. Fourth, reduce prolonged sitting. Extended sitting compresses the perineum directly, restricting blood flow to the pelvic region for hours at a time. If your work involves long periods at a desk, commit to standing and walking for at least 2 minutes every single hour. Stretch your hips, move deliberately, restore circulation. Your masculine system was not designed to function optimally under the chronic compression of 8 or more hours of sitting per day. You must counteract this. Fifth, nutritional support for blood flow. Prioritize foods that actively support nitric oxide production and healthy vascular function. Beets, dark leafy greens, watermelon, walnuts, and quality dark chocolate all contribute meaningfully to improved circulation throughout the body. When you build this nutritional foundation alongside the perineum massage and the 4 other practices I have outlined, you are creating a comprehensive, fully layered system that works from every available angle simultaneously. That is the level of approach that produces transformative results. Let me now give you accurate, honest expectations for your personal timeline, because setting the right expectations is part of responsible guidance. Week 1. External changes may be subtle, but what you are doing in this foundational week is establishing the neurological and circulatory patterns on which everything else will be built. Most men report increased awareness and heightened sensitivity in the pelvic area during this initial period. Pay attention to these early signals. They indicate that nerve pathways are beginning to reactivate. That is a meaningful sign. Week 2. This is typically when men begin noticing something genuinely different. Stronger morning responses begin returning, sometimes for the first time in months or even years. Your body is communicating clearly that something significant is shifting. Take note, this is the beginning of real recovery. Weeks 3 and 4, the primary breakthrough window. The majority of men who have been consistent through the first 2 weeks report meaningful improvements in functional response during intimate moments. Not incidentally or occasionally, but reliably and responsively. This is also the period when confidence begins rebuilding, because physical function and confidence do not operate independently. They reinforce each other directly. Weeks 6 through 8. For those who have remained committed, the gains from weeks 3 and 4 are now becoming your new baseline. Stronger circulation, more responsive nerve function, and rebuilt confidence are no longer exceptional experiences. They are simply what you expect. They are your new normal. The absolute requirement underpinning all of this is consistency. 3 days of effort followed by abandonment produces nothing of substance. Your body rebuilds over time in response to sustained, repeated, deliberately applied stimulus. Think of it exactly as you would think of physical training. No man builds genuine strength from one session at the gym. He builds it by showing up every day, applying consistent effort over weeks and months, and trusting that biological adaptation will follow. Masculine vitality restoration operates by the same principle. Your individual timeline will be shaped by your age, health history, current stress levels, and the duration of the difficulties you have been experiencing. Do not compare your progress to any other man. Measure yourself only against where you started. Acknowledge every small improvement as real, meaningful progress. Recognize it, celebrate it, and keep going without stopping. Before we close, I need to address several important safety considerations, because your well-being is my primary obligation here. If you have any active infection in your genital or anal area, wait until that condition is fully and completely resolved before beginning this practice. If you are currently managing hemorrhoids, you can still use this technique, but apply lighter pressure, move more slowly, and remain attentive to any discomfort. Adjust in real time based on what your body is telling you. If you have undergone recent pelvic surgery, including any procedure involving the prostate, speak with your physician before starting any new pelvic massage practice. That is not a suggestion. It is a clinical requirement. If you experience sharp pain, burning, or any unusual symptom during or after this technique, stop immediately and consult a healthcare professional. Pain is a signal. Signals require a response, not an override. Understand clearly that this technique is designed to complement comprehensive medical care, not to replace it. If you are managing serious underlying conditions, this practice belongs alongside your medical treatment, contributing to your overall approach. Think of it as a powerful and validated tool in your wellness toolkit, deployed intelligently as part of a broader strategy. All right, gentlemen, let's bring everything together. You now have a clear understanding of the perineum, the most overlooked and underutilized pressure point in men's health. You know exactly where it is, how to locate it, and how to apply the correct technique to produce maximum, lasting benefit. You understand the science behind why this works. You know the realistic timeline of what to expect and when. And you know how to amplify your results significantly with 5 additional evidence-supported practices that reinforce everything you are doing. The only remaining variable is your decision. Are you going to act on what you have learned today? Or are you going to let this information sit at the back of your mind, slowly fading into the background like so many other things you have watched and intended to do something about? Here is what I want you to do right now, before you close this video. Make a commitment to yourself out loud. Say it clearly. I will do this for 30 days, not silently, in your head, out loud. Because speaking a commitment into existence is the first concrete act of accountability you can perform on your own behalf. Then open your phone and set 2 daily reminders. 1 for morning, 1 for evening. Label them whatever you choose, something private and clear to you. Make them recurring and non-negotiable. Starting tomorrow morning, perform your first 1-minute perineum massage session. Follow the technique exactly as I have outlined it. Be precise, be consistent, be patient. Trust the process, and trust your body's remarkable capacity to restore itself when given the right conditions and the right direction. Drop a comment below right now. Tell me you are committing. Just type I'm in. I read every comment personally. And I want to see this community of men holding each other accountable. Accountability changes outcomes. Use it. If this video delivered real value to you, press that like button. It helps this information reach other men who need it and have not found it yet. Subscribe to this channel with notifications enabled, because this level of actionable, evidence-based guidance is coming every single week. Share this video with the men in your life who are facing these challenges. Your brother, your father, your closest friends. Someone in your circle needs this information right now, and sending it to them is one of the most straightforward acts of genuine respect you can offer another man. Gentlemen, let me leave you with this. Your vitality does not have to be a casualty of the years passing. Your body has the capacity to heal, to rebuild, and to restore. What it needs from you is knowledge, consistency, and commitment applied without compromise. You now have the knowledge. Consistency and commitment are yours to bring. This is Dr. Daniel Morgan, reminding you that it is never too late to take back your masculine power. Start today, stay disciplined, and come back and tell me what changes you experience. I will see you in the next one.